Welcome to this video about ovarian cancer symptoms. Have you or someone close to you ever felt a strange bloating that would not go away? Or maybe a constant pressure deep in the lower belly that doctors said was nothing serious? What if those quiet signs were actually your body warning you about something far more dangerous every year? Over 313,000 women around the world face a life-changing diagnosis. And shockingly, more than 70% of them discover it when it's already in a late stage. Why? Because ovarian cancer hides behind ordinary symptoms. It mimics things like gas, fatigue, or bladder problems. It does not shout, it whispers. That is why so many cases go undetected until it's almost too late. But what if you could recognize the red flags early? What if you could protect yourself or someone you love just by knowing what to look for? In this video, you will discover 12 warning signs of ovarian cancer backed by real science. These are not random internet claims. They are drawn from studies in journals like Gynecologic Oncology and American Family Physician. Some of these signs may already be showing up in your daily life. And symptom number 7 is one that most doctors rarely mention, even though it appears in thousands of early cases. So stay with us until the end, because knowing what to watch for might just save your life. Number 1, persistent bloating. It might seem harmless at first. A little belly swelling after lunch, pants feeling tighter than usual. But when bloating shows up every day and refuses to go away, it's time to listen closely. Persistent bloating is one of the earliest and most overlooked signs of ovarian cancer. Unlike normal gas or occasional indigestion, this type of bloating lingers for weeks and doesn't respond to diet changes. What's really happening inside the body? As ovarian tumors begin to grow, they often cause fluid buildup and pressure in the abdomen. This leads to that stretched, full feeling that never seems to ease up. A 2023 study in the Journal of Gynecologic Oncology confirmed that abdominal bloating was the most common early symptom reported by women later diagnosed with ovarian cancer. One woman shared that she blamed her bloating on stress and poor eating until her jeans wouldn't zip up for days. Her cancer was caught just in time. The truth is, if bloating lasts more than 2 weeks and comes with other strange symptoms, it's not just digestive, it could be dangerous. If you feel like your belly has changed and won't return to normal, speak to a doctor. But just knowing this isn't enough, because what comes next is even more dangerous. Number 2, pelvic or abdominal pain. Now let's go deeper. If bloating is your body whispering, then pelvic or abdominal pain is when it starts to raise its voice. This is not just a random cramp or the kind of ache you expect during your cycle. It's a dull or sharp pain that lingers in your lower belly, often ignored or blamed on digestion or stress. But here's the danger. Ovarian cancer often grows silently and presses against nearby tissues and nerves, causing discomfort that feels small but never truly disappears. According to a 2023 report in JMA Oncology, over 60% of early-stage ovarian cancer patients reported this type of pain, and most of them brushed it off for weeks. One woman thought it was from lifting heavy groceries, but it kept coming back. By the time she investigated it, the tumor had already spread. Your body knows when something isn't right. Pain that keeps showing up month after month is not normal. If it happens more than 12 times in a month, don't wait. Talk to your doctor. Rule it out. But just knowing this isn't enough, because what comes next might be hiding in your meals without you even realizing it. Number 3, feeling full. Too fast. Bloating and pain are hard to miss. But what if the warning shows up at your dinner table? Imagine eating just a few bites and suddenly feeling like you finished a 3-course meal. If that sounds familiar, you might be experiencing early satiety, a silent red flag that often gets mistaken for stress or a busy lifestyle. Here's what's really happening. Ovarian tumors can press against the stomach and nearby organs, shrinking the space available for food. Even small meals feel too much. This isn't about dieting or eating less. It's about your body telling you something is wrong. A 2024 study from the Indonesian Journal of Cancer found that early satiety was one of the most reported symptoms in women diagnosed with late-stage ovarian cancer. One woman shared that she started skipping dinner altogether because she thought her metabolism had changed. In truth, her growing tumor was compressing her stomach from the outside. If you're getting full too quickly for days or weeks in a row, especially with bloating or discomfort, it's time to speak with your doctor. Don't ignore a symptom just because it feels small. But just knowing this isn't enough, because what's coming next might be hiding in the most private part of your daily routine. Number 4, frequent urination or urgency. You might expect cancer to cause pain or fatigue. But what if the next warning comes from something as ordinary as your bathroom habits? Going to the restroom more often than usual might not seem alarming. Most people chalk it up to drinking more water or aging. But here's what you need to know. Frequent urination or sudden urgency can be a hidden sign of ovarian cancer. The ovaries sit close to the bladder. As tumors grow, they press against it, reducing its capacity and making you feel like you need to go, even when there's barely anything there. It's subtle, it's easy to ignore, but it's also serious. A study published in the Journal of the American Medical Association revealed that over half of women with ovarian cancer reported urinary symptoms like urgency and frequency, long before they were diagnosed. One woman believed she had a minor bladder infection, but after multiple rounds of antibiotics and no improvement, doctors finally ran a pelvic scan. The results shocked her. It was stage 2 ovarian cancer. If you're running to the bathroom more often without a clear reason, especially paired with bloating or pressure, don't delay that doctor visit. Early checks could change everything. But just knowing this isn't enough, because what happens next could silently drain every ounce of your energy. Number 5, constant fatigue. Frequent bathroom trips may disrupt your day, but what if the next sign is even more invisible? Fatigue that never seems to go away is one of the most misleading symptoms of ovarian cancer. Not the kind of tiredness that comes from a long day. This is the kind that clings to you no matter how much rest you get. You wake up exhausted, you feel drained by noon, and even simple tasks feel heavy. Here's why it matters. As cancer grows, it steals nutrients, disrupts hormones, and causes chronic inflammation. The result, a full-body energy crash that can last for weeks. A study published in the Oncology Nursing Forum tracked fatigue levels in women with early-stage gynecologic cancer. Over half of them experienced deep, persistent exhaustion long before their diagnosis. One woman described it as walking through mud every day. Her sleep was fine, her blood tests were normal, but she felt like her body was slowly shutting down. When the fatigue worsened, she pushed for more testing, and that's when doctors found the tumor. If you feel worn out for weeks without a reason, listen to your body. It might be fighting something deeper than just stress. But just knowing this isn't enough, because the next symptom touches something many women feel too embarrassed to talk about. Number 6, pain. During intercourse. Fatigue can drain your days. But what if the next symptom appears during your most private moments? For many women, pain during intercourse feels like something they just have to accept. Doctors may blame it on hormones or aging, but the truth is, deep pelvic pain during sex could be a warning sign of ovarian cancer. This type of pain is not surface-level discomfort. It often feels like a sharp or aching sensation deep inside the pelvis, caused by tumors pressing on nerves, tissues, or surrounding muscles. And it can start subtly. A little pressure, a little tenderness. Then gradually, it becomes harder to ignore. A study published in American Family Physician found that women with early-stage ovarian cancer were significantly more likely to report painful intercourse months before diagnosis. Sadly, many of them were told it was just menopause. One woman shared that intimacy became something she feared. Every time was painful. Every time felt wrong. When she finally brought it up to her doctor, it led to a life-saving pelvic exam. If sex suddenly becomes painful and it feels new or unusual, don't ignore it. Your body may be signaling something deeper, but just knowing this isn't enough, because what comes next might already be hiding in your monthly cycle, and you may not even see it coming. Number 7, menstrual irregularities. Pain during intimacy is deeply personal, but sometimes the next warning appears in a place women know best: their monthly cycle. A late period here, heavy bleeding there. It feels random at first, but here's the truth. Unexpected menstrual changes can be one of the earliest signs of ovarian cancer. This doesn't mean every late period is dangerous, but when cycles become consistently unpredictable, heavier bleeding, shorter intervals, or spotting between periods, it's time to pay attention. Tumors can disrupt hormone balance and interfere with the reproductive system, triggering changes that feel subtle but are anything but harmless. A major study from the International Journal of Cancer tracked over 15,000 women and found that those with irregular menstrual cycles had up to triple the risk of developing ovarian cancer by age 77. One woman shared that her periods suddenly started coming every 2 weeks. Her doctor blamed stress, but deeper testing revealed something far more serious. If your period suddenly changes and stays that way for more than 2 or 3 cycles, don't dismiss it. Your cycle is your body's built-in warning system. But just knowing this isn't enough, because the next symptom often hides behind something as common as indigestion, and it fools nearly everyone. Number 8, indigestion or heartburn. Changes in your cycle are hard to miss. But what if the next symptom feels as ordinary as a heavy meal? Recurring indigestion or heartburn might not seem like a red flag. After all, we blame it on spicy food, late dinners, or stress. But when it becomes a daily guest at your table, it could be something far more serious. Ovarian cancer can disrupt digestion by pressing on organs like the stomach or intestines. This leads to feelings of fullness, burning in the chest, or stomach pain even after eating small meals. It's so common that many women dismiss it for months. A study from the UK collaborative trial on ovarian cancer screening revealed that gastrointestinal issues were more common than vaginal symptoms in early-stage ovarian cancer cases. One woman said she kept chewing antacids every night. Nothing helped. When her stomach bloated and her appetite dropped, she finally went in. A scan revealed tumors pressing against her gut. If you're dealing with daily indigestion or heartburn that doesn't respond to lifestyle changes, don't ignore it, especially if it comes with bloating or fatigue. But just knowing this isn't enough, because what comes next might look like weight gain, but it's something much more dangerous. Number 9, swollen abdomen with fluid. At first sight, it might seem like just a little bloating, but when your stomach starts to swell and nothing you do can make it go away, it's time to listen carefully. Fluid buildup in the abdomen, known as ascites, is one of the more serious, yet often overlooked signs of ovarian cancer. Here's the problem: as tumors grow, they can irritate the lining of the abdomen, causing the body to leak fluid into the space around your organs. The result, a swollen belly that feels tight and uncomfortable, and it might make it hard to even breathe or eat normally. A 2015 study published in Nature Reviews Cancer revealed that ascites is linked to more advanced stages of ovarian cancer. One woman said she started noticing her pants felt tighter, and her abdomen was visibly larger. She thought she was gaining weight, but it was fluid. She had ovarian cancer, and the fluid buildup was a direct result of tumors pressing against her organs. If you notice any unexplained swelling in your abdomen that doesn't go away, talk to your doctor. Don't wait until it's too late, but just knowing this isn't enough, because the next symptom could be causing you daily pain that feels like it's coming from nowhere. Number 10, nausea and vomiting. That swollen belly might not be just fluid. In many cases, it leads to something even more alarming. Persistent nausea or vomiting can feel like the flu or a sensitive stomach, but when it happens without any clear reason and keeps coming back, it could be your body raising a red flag. As ovarian tumors grow, they can press against the stomach or intestines, slowing digestion or blocking part of the bowel. This triggers unexplained nausea, sudden vomiting, or a constant uneasy stomach. Unlike typical food reactions, this discomfort is deeper and more stubborn. A 2022 study from Gynecologic Oncology tracked over 100 women and found that nearly 36% experienced ongoing nausea or vomiting before being diagnosed. Many of them assumed it was diet-related or stress. One woman said her nausea started off mild, but eventually, she couldn't keep food down. That's when doctors discovered a tumor pressing against her intestine. If your stomach feels wrong day after day, and nothing you eat or avoid makes it better, it's time to ask why. Don't brush it off as something minor, but just knowing this isn't enough, because the next symptom might start in your legs, and you'd never expect cancer to be the cause. Number 11, pain in legs or thighs. After battling nausea or vomiting, you might not expect the next symptom to strike somewhere completely different, but leg or thigh pain, especially dull, deep, and persistent, can also point to ovarian cancer. It's easy to confuse it with muscle strain or sciatica, but when the pain lingers for weeks, it's time to look deeper. As tumors expand, they can press on nearby nerves or blood vessels, especially in the lower back and pelvic area. That pressure radiates into the thighs and legs, creating a deep ache or numbness that doesn't improve with rest or stretching. It may feel like tension in one leg, or even strange sensations along the nerve path. A case study in the American Journal of Case Reports highlighted a woman with 2 years of unexplained leg pain and tingling. Doctors originally treated it as a spine issue, but a scan finally revealed a large ovarian tumor pressing into her sacral nerves. Surgery changed everything. If your leg pain feels unusual, one-sided, or gets worse over time, especially when paired with bloating or fatigue, don't ignore it. Your body could be warning you of something hidden, but just knowing this isn't enough, because the next symptom is often dismissed as nothing, but it could be your earliest chance to catch cancer in time. Number 12, unusual vaginal discharge. Leg pain may seem far removed from your reproductive health, but sometimes the most direct warning comes from where it all begins. Unusual vaginal discharge is often misunderstood or dismissed, but when it becomes persistent, watery, bloody, foul-smelling, or just off from your normal pattern, you need to pay attention. Certain types of ovarian cancer, especially stromal or germ cell tumors, can affect hormone production or irritate surrounding tissues. That can lead to discharge that doesn't look or feel right. It may be light and constant, or it may come with spotting between periods. Either way, it's your body signaling imbalance. A CDC-backed study reported that some women diagnosed with early-stage ovarian cancer noticed vaginal discharge as their only clear symptom. One woman shared that she ignored hers for months. No pain, no bloating, just a strange discharge she assumed was hormonal. When she finally got checked, her cancer was caught just in time. If anything changes down there and it doesn't go back to normal, do not wait. It's not just about comfort. It's about catching something early while it's still treatable. But just knowing this isn't enough, because now comes the most important part. What to do next if any of these signs sound familiar. You've just learned 12 powerful signs that could change everything. Some are silent, some are strange, but all of them matter, especially when you're listening to your body at the right time. Ovarian cancer doesn't always come with dramatic warnings. It often shows up quietly through things like bloating, fatigue, or subtle changes that feel easy to ignore. But now, you're ahead of it. If even one of these signs felt familiar or reminded you of someone you care about, please don't wait. Talk to a doctor. Ask questions. Get a second opinion. Because catching something early isn't about fear. It's about clarity, about taking back control, and about giving yourself a second chance. You don't need to overhaul your life overnight. You just need to start. That's why this channel exists, to walk with you, to give you real, science-backed tools to protect your health after 60. From practical nutrition tips to the latest medical insights, we're here to make senior health simple, clear, and life-saving. In our next video, we'll share 5 powerful foods that naturally support hormone balance for women over 50, including one that's probably already in your kitchen. So if you found this video helpful or eye-opening, take one small step today, save this video, subscribe to our channel, and share it with someone who might need it. You are not alone. You are not powerless. And this is just the beginning of your better health journey.